The Dr. Fazil Show is brought to you by Health Tips Media. The Dr. Fazil Show is intended for health educational purposes only, and complies with all HIPAA regulations. Enjoy the show.
Hello folks, I'm Dr. Fazil. I'm a kidney specialist as well as internal medical specialist. So I specialist both in internal medicine as well as in kidneys and related disorders. I have been practicing I have been in practice for many years. Today you're watching March 2024 edition of Dr. Fazil TV show. The topic of discussion today is, folks, the kidneys, anatomy, how the kidneys function, where they are located, in the body, and what they do, and how would the kidney pain will feel like. I think that's the most common question has been asked, is that how the kidney pain feel like. Is the kidney pain is the same as the back pain? Sometimes the kidney pain mimic the back pain, so we have to sometime know. So my idea for my discussion today is to give some brief introduction to the kidneys and their functionality, as well as the common symptoms of kidney disease, as well as the pain which can come from the kidneys, and then we will take some questions at the end of my discussion. So let's jump right in. So folks, before we move forward, let's do one thing. So we're gonna do a basic introduction to the kidneys, where they are located in the body. So folks, I'm gonna bring a live hologram in front of you. You can see right here. This is a human body, and you can see, let's twist it a little bit, and you can see on the back side we have two kidneys. The kidneys weigh around the size of your fist. Remember, so size of your fist, the kidneys are as big as the size of your fist. They weigh around 150 grams. Remember, so 150 grams each kidney. They are made up of something known as nephrons. Nephrons is like bricks of the wall. They are the building blocks of the kidneys. There are 1.5 million nephrons in each kidney. 1.5 million, right? So the kidneys do a lot of things. But before we do discuss about that, let's jump inside the kidney. So I'm going to jump right into the kidney. So, okay, now you can see all around me, I'm in the kidney. This is that's the opening of the kidney. Here is all the material which is filtered by the kidney goes into the tube known as the ureter. And then on the left side, you can see all those arteries. The blood comes from the heart. That is the dirty blood which goes into those filters. We call them glomeruli. You can see on my other side. And it gets filtered out and then get into the urine. And the urine goes into this tube on the right side. This is known as ureter, right? So, and then the clean blood goes through the renal vein. You can see this blue blood flowing back to the out of this kidney. We call it a renal vein. So the artery in kidney is opposite. So mostly in other part of the body, the arteries take the fresh blood, and the veins take the dirty blood. You can put it that way. But in the kidneys, the renal artery or the artery of the kidney bring in the dirty blood and then get washed up, cleaned up in the kidneys, and get into the clean blood, and it goes back to the body through renal vein, and all the waste material get filtered out through the filtration process in the kidney inside the ureter and make urine. So that's the basic anatomy of the kidney. Let me jump right back out of the kidney. Back into the stage. Now let's this hologram go away. So now we're going to talk about besides those two kidneys. Okay, so where they're located, as we discussed, you can see. Let me bring another hologram right here. You can see there are two kidneys, one on each side of the spine. They're right underneath the rib cage, right? So right where your last rib is and the spine is, the kidneys are one kidney is on each side of that area. We call it renal angle. That's the medical terminology. So if you're going to have a pain from the kidney, most likely you're going to have the pain in that area. So what we do, we punch on the back of the patient's that area. If the kidneys have infection or has a high pressure in the kidney due to blockage, when we thump on that area, they will feel pain. This is known as percussion, right? Percussion is like you thump on something, we call it percussion, right? So that's how you find out if it's kidney pain or not. So now, but if there's a stone which is coming from, and now let's bring another hologram right here. You can see there's a stone, and stone is stuck in the ureter. So if the stone is stuck in the ureter, you might have the pain down below, not in the same area, but you might have where the ureter is going. It could be in your mid-abdomen or into the front of your pelvic area, so you can have pain there as well. So the pain of the kidney could be in all that pathway wherever the urine go. So we can get that information very easily by taking a good history from the patient, good examination. Sometimes you have to do certain diagnostic like X-ray of the abdomen or ultrasound of the kidney or CAT scan. Sometimes we do an MRI as well, but between those modalities we'll find out if the kidneys are causing pain, and then certain blood tests will also indicate along with the urine test that if this is kidney pain or something else. So those are the basic tools we have as a medical professionals to find out if the source of the pain or dysfunction is from the kidney or something else, right? So let's talk about a few more things. Now, we talked about what the kidneys do. Remember, the kidneys not only do filtration of the blood and make urine, but they also control blood pressure. So there's, let's bring another hologram right here. You can see these are the renal arteries, and they're taking the blood to the kidney. So, and then the blood is coming right back through the renal vein. So if there's a blockage in the renal artery, and that could be due to plaque buildup or due to genetic reason, if there's a fibrous ring in that area, that can cause impaired blood flow to the kidneys. What the kidneys do, they react by producing certain hormones on the renin. The renin cause high blood pressure. That causes the blood vessel to constrict, and the blood pressure goes up. And there's medication, and for that, sometimes you have to fix the blockage by angiogram and doing a stent placement, or just using the medication, So we call it secondary hypertension. So there are two kinds of high blood pressure: primary high blood pressure, or essential hypertension, or primary hypertension, where you get high blood pressure due to aging process and atherosclerosis and thickening of the blood vessels, or secondary hypertension, that is due to something else, and that could be mostly due to kidneys. So basically, the point I'm trying to make it here is that the hypertension is actually primarily a specialization portion of the nephrologist or kidney specialist. Most people think it is a cardiologist. It could be done by anybody who knows what they're doing, but primarily the kidney specialists are trained heavily on management of blood pressure, because kidneys control the blood pressure, not the heart. Just remember that. So, and they control blood pressure by releasing certain chemicals we call hormones, which can cause, it's like a management tool of the kidneys by reducing chemical, like, for example, renin. Renin goes effect on the blood vessels through another chemical, and that cause blood vessel to become smaller or bigger and control the blood pressure. So that's important to know that. So kidneys also make another hormone known as erythropoietin. Erythropoietin goes act on your bone marrow and make blood. So kidneys also make vitamin D as well. Remember that. So if you have a kidney disease, you will be low in blood count, you will be low on your vitamin D, and your blood pressure would be high. Remember, so that's why, because the kidneys take care of all that. That's why when the kidneys are not working 100%, you're going to have swelling. And you can see here's the kidneys not working here, and you can see that the fluid is being backed up and the legs are being swollen. So you can see the legs are swollen. Let this hologram go away. Now let's go back to our further discussion. So the other discussion is
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
what are the symptoms? The symptoms of kidney depends on the kind of problem they have. For example, if you have a stone in the kidney, you will have a pain in the back or wherever the stone is stuck in the ureter. If you have infection, you will have pain as well as fever. If you have low kidney function, generally at early stage you will not have any symptoms. So that's why it's important to get just, when you have your blood drawn or tested, ask your primary care provider what is your kidney function is, because if it is early intervention is required, that is better than waiting till you have a progression of disease and then we are talking about kidney transplant or dialysis. So that all can be prevented by keeping an eye on your blood test and making sure your kidneys are where they're supposed to be. And if they're not, then the primary care can either have your, if they know how to manage it, they can manage the kidney function themselves, or at least have you seen by a kidney specialist. So you can also check your kidney function. There's a blood test known as serum creatinine. Creatinine normal is like 1, just for simplification process. And there's a formula which is available on our website, or you can also do Google search it, humakidney.com. humakidney.com, you can see under, in the link below. If you go on that website, you can punch in your, we call it GFR calculator. You can punch in your age, your age and your gender and creatinine. And the higher the creatinine, the lower the kidney function is. So it will give your kidney function in GFR. So normal kidney function, for simplification, we will say it is 100%. So then whatever the number is, then you can have a classification of your kidney problems. There are 5 stages of kidney disease. Stage 1 is normal. Since stage 5, somebody needs dialysis. So if you are at, between above 60%, you're in stage 2, above 90% stage 1, between 60 and 30% stage 3, and 30 and 15% stage 4, less than 15% is stage 5. And stage 5 is when you need dialysis. So obviously, if you're in stage 3, 2, that's where you need to start intervention to prevent. There's a lot of kidney conditions which can cause kidney disease, like inflammation, medication side effects. So you must be, this must be looked into early enough. However, unfortunately, if you end up in progressive kidney disease and you see your provider in the late stage, then transplant is an option. The kidney transplant can be done early. Once your kidney function is 20% or below, you qualify for kidney transplant if you're medically stable or clear from other medical issues, which is a long discussion, but you can talk to your primary providers about that. And you can have a kidney from a diseased person or from a living donor, depending on the situation you have. The other thing is, in the state of Arizona, the waiting time for kidney transplants is almost around 2 years. So once you are on the list of kidney transplant, or you start dialysis or hemodialysis or peritoneal dialysis, there are 2 kinds of dialysis, hemodialysis and peritoneal dialysis. So if you are on one of those dialysis, the clock starts, So even though the application gets filled out later, it's still approximately in Arizona, the time is around 2 years. So these states have different waiting times. So fortunately, Arizona is one of the states where you can get the kidney transplant fastest. So that's a good thing about Arizona, right? So folks, on that note, I will conclude my discussion for today. So if you have any questions, I will ask. We have an avatar on our stage today. Let's ask her if you have any questions, and then we'll go from there. Thank you for watching Dr. Fazil TV show. Question, please.
What are the common medications that can cause kidney problems?
Well, that's a very good question. So because a lot of patients are not aware that a lot of painkillers, for example, ibuprofen, morphine, naproxen can cause kidney damage. So if you have kidney problems, maybe you can take Tylenol, but try to avoid those medications. We call them NSAIDs. Generally, if you take a prolonged use, if you have a prolonged use of kidney disease, but they by itself can cause kidney dysfunction. Well, it was a very good question. Another question you have?
What kind of diet should someone with kidney disease follow?
Yeah, so it's designed a case-by-case basis, but in general, low protein diet, less meat and less beans, for example, that's what we say. That should be used and should avoid certain kind of chemicals, for example, iodine, which is injected inside the veins, arteries actually for the angiograms or for the CAT scans. That can also cause destruction to kidney function. So they should avoid, chemicals like that, plus low protein diet, like 1 gram per kilogram per day. So if you're 70 kilogram weight, you should have 70 grams of protein per day. Yes, that's kind of general rule of thumb. Good question again. I don't know what your name is, but I will call you, for example, you're obviously an avatar, so I will call it Avatar. How about that?
Thank you.
Any other questions you have, Avatar?
I do not have any more questions today. Thank you for the information.
So folks, I think that was the end of my discussion for today. We'll be back. I will be back next month with a more interesting topic for your education. Remember, the best thing you can do as a person is learn a new skill and invest in your health. So learning education about your health is the best single tool you can get. So folks, that's what I'm trying to do here, to give you a tool and education about your health so you can invest in your own health. We live once and we have single bodies. So folks, do take care of your body and your health. And on that note, you were watching Dr. Fazil TV show, and I will be back next month. Folks, God bless you. God bless America, and have a wonderful rest of the month. Thank you.